Sandy is 29 years old and experiences bleeding between periods. The nurse marks which of the following on Sandy's medical chart? A. Metorrhagia. B. Menorrhagia. C. Menomtorrhagia. D. Polymenorrhea. E. Oligomenorrhea. The answer is A. Metorrhagia. Metorrhagia is bleeding between periods. Menorrhagia refers to excessively heavy periods. Oligomenorrhea refers to light, scattered periods, typically spaced by greater than 35 days. Polymenorrhea is used to describe short cycles of equal to or less than 21 days. Menomtorrhagia is used to describe periods that are heavier, sporadic, and more frequent than normal periods. A patient tells the nurse that she is practicing fertility awareness. The nurse tells the patient that the unsafe period can range from A. 2 days before and 1 day after ovulation. B. 7 days before and 7 days after ovulation. C. 2 days before and 2 days after ovulation. D. 1 day before and 1 day after ovulation. E. 1 day before and 2 days after ovulation. The answer is B. 7 days before and 7 days after ovulation. According to the family planning method of contraception, the period in which conception can occur and one should refrain from intercourse is up to 7 days before and 7 days after ovulation. Some references show that sperm can live for up to 5 to 7 days inside the female reproductive system. An unfertilized egg can live from between 12 to 24 hours. This greatly increases the window in which conception can occur. Which of the following is false regarding oral contraceptives? A. They may reduce the risk of uterine cancer. B. They may heighten the risk of depression. C. They may decrease the risk of breast cancer. D. They may increase the risk of developing a blood clot. E. They may decrease the severity of menstrual cramps. The answer is C. They may decrease the risk of breast cancer. Oral contraceptives may increase the risk of breast cancer, increase the risk of depression, and increase the risk of developing a blood clot, higher in women who smoke cigarettes. They can reduce the risk of uterine cancer and are frequently used in women with primary dysmenorrhea. Primary dysmenorrhea refers to painful menstrual cycles without an underlying cause. A 51-year-old female arrives at her doctor's office because she has not had any periods for 12 months. The nurse should suspect A. Pelvic inflammatory disease. B. Endometriosis. C. Menopause. D. Polycystic ovarian syndrome. E. Pregnancy. The answer is C. Menopause. Amenorrhea is the complete absence of a period. There are many different causes for amenorrhea. One of the most frequent causes of amenorrhea for women in the 5th decade of life is menopause. Menopause is the most likely cause of amenorrhea in this particular patient because she has not been experiencing periods for 12 months and is 51 years old. While pregnancy is possible, the nurse would suspect menopause first. Pelvic inflammatory disease, PID, is a pelvic infection usually resulting in severe pain. Endometriosis is a condition in which uterine tissue inappropriately grows in areas such as the rectum or ovary, also typically causing severe pain. Polycystic ovarian syndrome is a condition causing hormone imbalance. It can cause amenorrhea. Jody is a 40-year-old woman seeking care for dysmenorrhea for the first time. Which would not be considered an appropriate treatment? A. Oxycodone, acetaminophen. B. Naproxen. C. Oral contraceptives. D. Ibuprofen. E. Lifestyle modifications. The answer is A. Oxycodone, acetaminophen. There are many different ways to treat painful periods, dysmenorrhea. Ibuprofen and naproxen are anti-inflammatory agents that do not require a prescription and can be very effective. They have relatively few side effects. Lifestyle modification, such as exercise, is another good alternative. The use of oral contraceptives are also frequently used to give women lighter and milder periods. Percocet is not generally used because it is an opioid analgesic and not recommended for long-term use because they carry potential for addiction.